Dr. Tserha also will be presenting with him and also answering questions for us. Dr. Tserganish Salamab she practices internal medicine at Health Partners. She's also assistant professor in Department of Internal Medicine. I will first invite Dr. Kiragu. He will present in English, and then hello? Yeah, Dr. Kiragu will present first, and then Dr. Tserha will follow in Amharic and also answer some of our questions.
All right. Okay, I'm going to go ahead and share my screen. Hopefully this works after these 2 years of Zoom. And then there we go. Hopefully you can see my my screen. Okay.
Yes, you can see. Thank you.
All right. So thank you so much for that kind introduction. I'm hoping to spend a few minutes talking to everyone about the importance of vaccinating our children and keeping them safe against COVID. As Yeshak mentioned, I'm an ICU physician. And so actually this past week, I was on service in the ICU and admitted quite a number of children with COVID. When COVID first started, it wasn't really impacting children that much. And I think we were fortunate that way. It seemed to affect older people. It seemed to affect people who are in assisted living facilities, nursing homes, and then of course people with certain risk factors. But children seemed to be kind of spared. With the Delta and now Omicron variants, and we'll talk a bit about that in a little bit, we are seeing more and more children coming in, either with respiratory illness because of COVID, or maybe they come in with seizures because of COVID, or they come in with what we call the multi-system inflammatory syndrome after COVID. And I'll show you some slides on that. So I feel it's so important that we do everything that we can to keep our children safe. If you look at the numbers, unfortunately, the children and even the adults being impacted in a disproportionate way look like us. They are Black and brown, they are Somali, they are Ethiopian, they are Kenyan, African American, Hispanic. These are the ones who are being impacted more, which is why it's so important for us to keep ourselves safe and our children safe. So I'm not going to belabor this. This is just a quick info graphic from the CDC, just to show you the symptoms, which can be, a cough, or, shortness of breath, difficulty breathing, might have a fever, chills, might have body aches, vomiting or diarrhea, maybe the loss of taste or smell. But sometimes people might not have much in the way of symptoms. Maybe someone might just feel tired for a period of time, and then they are better. But even though their symptoms are not that great, they can make someone else sick. So you might have someone in your house who has COVID. They might not be that sick, but maybe you have your grandmother there, or maybe you have your little baby there and they get COVID. So we have to be so careful with this disease. And it can cause severe illness in children. People don't often think about that COVID can create and cause severe illness in children. And unfortunately, just in the last year, I've been involved in the care of 2 children who've died. And I'm just one doctor. So imagine your teenager or younger child gets sick and dies from COVID, which is a preventable disease. Of course, if your child has an underlying illness, maybe they have leukemia or some other illness that makes them more at risk for getting sick, they are at higher risk. So kids with genetic diseases, neurologic diseases, metabolic diseases. And then, of course, children who have obesity, diabetes, asthma, problems with chronic lung disease. So if your baby was born premature, or anything else that causes the immune system not to work well, puts them at increased risk for severe illness from COVID. And sometimes people don't know or get a feel for what someone with severe COVID looks like. Okay, so these are CT scan and X-ray of some people with children with COVID, with severe COVID. And when you have each of these pictures, and my pointer unfortunately is not working, but everywhere on the X-ray where you're seeing all this white, where the lungs should be, all this white kind of material, that's all inflammation and illness from COVID. Now imagine those are your lungs that are so inflamed, so you can't breathe. That's why people have shortness of breath. That's why they have low oxygen. And so, I mean, it's pretty scary. And then even though sometimes children might not have significant symptoms with a COVID infection, they can, a number of them can also develop something called multi-system inflammatory syndrome. This is where different parts of the body become inflamed, including the heart, the lungs, the kidneys, brain, skin, eyes, or even the stomach. They have vomiting, diarrhea. Since the pandemic started, there have been over 6,000 cases, and 55 of these children, unfortunately, have died. The median age is about 9 years old. So these are fairly young children, and half of the children are between the age of 5 to 13. And you can see predominantly Black and Hispanic children. These are our children who are getting this illness. Most of them had a positive test, at least in the past, or they had a positive antibody test, which said that they had been exposed to COVID in the past. And most of the victims of this are boys. This is just a picture that kind of gives you an idea of how kids with this multi-system inflammatory syndrome might look like. You can see this child has red eyes, so their eyes look red. They might have headache, they'll have fever, they may have complaint of chest pain, and then when you do tests, you see that their heart is inflamed. Many times these children actually present with low blood pressure. They need to be in the ICU, sometimes on a breathing machine, needing medications to increase their blood pressure. And then it can affect their blood, can affect their breathing. So, and this is someone who may have had COVID, but maybe wasn't that sick from COVID. In fact, somebody might have even forgotten. They say, oh yeah, about maybe 3 weeks ago, 4 weeks ago, maybe they had COVID, but they seemed fine. But now here they are in the ICU. And you can see mostly Black and Hispanic children, and then mostly in that 5 to 11 age group, but across from less than a year up to even 20 years old, you're seeing being affected. And there's even a syndrome being described in adults called the multi-inflammatory syndrome in adults. Of course, if you think about the situation in which we live in here in the United States, okay? So we have the highest number. This is supposed to be the richest, most powerful, most advanced country on this earth, okay? We have the highest number of infections. We have the highest number of deaths. And of course, I mean, I don't want to belabor because I get very angry about some of this stuff. A lot of this is so unnecessary. we started with a slow response. We were having trouble with testing. And then, of course, things were getting stretched. And even now, unfortunately, with the increase in numbers of COVID, here in our state, you can hear they're calling the military to come and help in the hospitals because there are not enough nurses. People are getting burnt out taking care of patients with COVID. The hospitals are full, so you can't even sometimes get a bed for your child who needs to be taken care of. Of course, here we have seen in this country that disparity. The people who look like us are the ones who are dying from this disease. Of course, politics. I mean, when disease becomes a political issue, this is where trouble starts, okay? The minute politics invaded this disease, and I have a few choice words for politicians, but maybe some of you listening might be running in a political office or whatever, but I will try not to say anything bad. But you put politics with a pandemic, people die. And that is what has happened. You're hearing people arguing, I don't wear a mask, give me my freedom. Okay, freedom to cough on me and give me COVID? Freedom to cough on my child and give them COVID? What is this nonsense? Of course, the impact on the economy, all these different, and then false information out there, and we'll talk about some of the myths. This is just showing how we are more likely to get sick and die from this disease. There are multiple reasons for this, whether it is we have some other underlying disease, maybe something in our genetic makeup. Of course, a lot of us have other stressors in our environment that make it more possible for us to get sick and all this. So maybe I'll save this slide for later. I just wanted to mention, people have heard a lot about variants, right? So, and just a variant is just, essentially a virus which has a slightly different genetic makeup, which makes it more difficult for the body and to protect the person, or even that it can make the vaccine that you get not effective. And we've heard about very many different viruses: alpha, gamma, delta, beta. Now there's Omicron, although I hear people call it Omarion. So my mother-in-law calls it macaroni. I mean, we have all these different viruses, but all, unfortunately, these are viruses, variants of COVID-19, which have come because it has been allowed to figure out a way to change the way it attacks the body to get in. Because people are not vaccinated, people haven't gotten, so then it just figures out, oh, this person, I will get this person sick, or let me figure out a different way. That's what viruses do. And a part of fighting the pandemic, of course, vaccination, which we're talking about today, social distancing, masking. These are just a picture showing how people, just think about when you're walking the streets, how people wear their masks. Some on their forehead, covering their nose and not their mouth, or covering their mouth, not their nose, putting it on their arm. Who is it protecting? On their ear. You have to put the mask properly so that you can protect yourself and others. So we'll talk, a little bit about how vaccines work is gleaned from how the body works. So here on the left-hand side, you're seeing the coronavirus. It has these spikes that look like crowns. That's why it's called coronavirus. So COVID-19, it enters into the body. Viruses they are very sneaky. They enter into your cells, their body, make copies of themselves. They actually use your own body as a factory to make copies of themselves. Then your body figures out, who is this in my house? So it starts fighting, okay? But by the time it's beginning to fight, you might have gotten quite sick. And unfortunately, many people have succumbed to this illness. So what the vaccines that we do get, the two vaccines that the three vaccines have been approved here, but the ones we're going to concentrate on, the one we'll concentrate on really is Pfizer, because that's the one that's been approved for children from age 5 on up. It's an mRNA vaccine. So what it does is, think of it as a Snapchat, a short message. You put it in the person, it goes into the cell and tells the cell, and then the mRNA codes for a particular protein, spike protein of the virus. So it tells the cell, make this is what you need to recognize. So now when COVID starts coming to you, already the body is ready. So your body is ready, it can fight the virus much more effectively than if you are just hanging around waiting, your body is hanging around and waiting to be infected. And then this is like this diagram essentially describes that process. And this is the same for both the Pfizer and Moderna vaccine. I won't talk too much about the J&J vaccine because it works through a different mechanism, but essentially it's a message to the body to make antibodies to the virus. And that's another thing for the for the Moderna, for the J&J. I think there's been some questions about now these vaccines were being given, has it even been tested on people who look like us? So at least the vast majority of the initial studies before the vaccines were approved, 75,000 patients, including people at various risks for disease, people from diverse communities, 83% white, 9% African-American and Black, 28% Hispanic. And you can see, unfortunately, the numbers for, and the 28% that seems higher for Latino is, the numbers might not add up, but there's some Latinos that identify as white. But anyway, you can see the number for Black people is low because many times people traditionally are a bit cautious, a bit suspicious of all this testing, but still there were a number of our brothers and sisters who were tested or were part of these studies. And of course, people worry, oh, was this done too quickly? Is it even safe? But really, the reason it was cut is that because they were already using technologies that are there, they were doing things concurrently. So whereas they do the testing and then after the testing, then they make the vaccine. They were actually manufacturing as they were testing. So, and then of course, if it worked, then they already have it ready. And then of course, the government poured a lot of money so that this could be done. And people all over the world were participating. Scientists all over the world were participating in this. Now, I talked about earlier, the only people really, Pfizer is the only one approved for children 5 and older. The Moderna can be given in children who are 18 and older. And Johnson & Johnson is for adults. People worried about side effects. Main side effects are the same kind of side effects you sometimes get whenever you get a vaccine, any vaccine. So you have arm hurts, there's some redness, swelling. Sometimes people might feel tired, headache, muscle pain, chills, fever, nausea, especially after the second dose. But these are effects telling you your body is getting ready. The vaccine is working. Your body is getting ready to fight the virus. There's a lot of words here, but the main things to mention is that one, you can get the COVID vaccine along with the other vaccines your child would be getting during that time, whether it's a flu vaccine or whatever, they can be given at the same time. And then to talk about some of the significant side effects. The one that people might have heard about is this thing called myocarditis, or the inflammation of the heart. And actually, there's a study that just came out within this last week that looked at the number of cases of this inflammation of the heart that have been reported through the vaccine adverse adverse effects response system. And out of there have been 192,405,448 people who have received the COVID vaccine. Okay, so and which means about 354 million, quite a large number of doses have been given, 354 million doses. Out of all those vaccines that have been given, there have been 1,991 cases of this myocarditis. The rates are highest in kids who are age 16 to 17. Most of the symptoms are fairly mild, usually chest pain, elevation of some heart muscle enzymes, abnormal EKG, and then usually with just supportive treatment, some aspirin or Tylenol or whatever, usually these kids have gotten better. But it's there, people are reporting it, and of course that is a concern. But if you compare the number of children who die because they have not gotten the COVID vaccine, it doesn't even compute, or the number of people who have died doesn't compute. So if you vaccinate your child, you can protect family members who can't get vaccinated or who are older. It can keep you from getting very sick. Even if you do get COVID, you hear people saying, oh, the person got vaccinated, but they got COVID. Okay, but they're not in hospital and they haven't died. And you'll hear even the stories of, oh, everybody in the hospital right now with COVID has been vaccinated. Okay. I'm an ICU doctor. I've been taking care of kids with COVID. And in my ICU, I haven't taken care of a kid with COVID who was vaccinated. And the 2 children I took care of who died from COVID were not vaccinated. Okay, so the vaccine protects you from getting seriously sick and protects you from the risk of dying. And if all kids 5 and older were to get vaccinated, then it's easier for schools to remain open. Kids can live their life, you don't have to worry. And then of course it protects the younger kids, and then the younger kids who can't get vaccinated, they should wear their masks. So we'll just end now with this, and I'm sorry I've gone a bit longer, but these are some myths that you'll hear people saying, okay? First of all, the vaccine does not give you COVID. The vaccine does not alter your DNA. Okay? So if you get the vaccine, you're not going to turn into a coronavirus. You're not going to turn into a rabbit or a bear or a giraffe. It does not alter your DNA. The vaccines do not contain virus. Okay? It's just a piece of what we call messenger RNA. It has nothing to do with live virus. It doesn't contain any microchips. Bill Gates had nothing to do with it. Doesn't contain any tracers. It doesn't contain mercury, preservatives, and doesn't contain any pork. Especially, people say, oh, it contains pork, I'm a Muslim, I can't. No, it does not contain pork. The vaccine is free. People who are pregnant, breastfeeding, or want to become pregnant can get it safely. All the ingredients of the vaccine are ingredients in major foods. They are fats, sugar, salts. Getting a COVID vaccine is a safe and more dependable way to build immunity. There are those who think, oh, but what if I just get COVID, then my immune system is ready, I don't need to get vaccinated? No. The vaccine gives you a much more dependable response so that your body is ready. The vaccines do not create variants. In fact, when everybody gets vaccinated, less variants come. And then people say, oh, we have all these events which are reported because of the vaccine. But you know what happens? This response system, which is supposed to report anything associated with the vaccine. So if you get the vaccine and then you go and have a car crash, they'll report it, but it doesn't mean the vaccine caused the car crash. It just happened. If you have, you go and, someone pokes your eye, it's whatever, they'll report it, but it's not the vaccine that took your eye. So you have to be very careful in kind of the reports that people say. The vaccine will not make you magnetic. And the vaccine will not cause you to have a positive test. Anyway, I'm hopeful that this information has been helpful. Please do your best to vaccinate your children. Don't listen to people who tell you not to vaccinate your children. We are all sometimes nervous, but better to be nervous and give the kid the vaccine and keep your kid alive and safe than to be nervous, do nothing, and then be crying that, oh, I wish. So thank you very much for this opportunity, and I'll wait for questions. And now, I might not understand all the Amharic, but I'm listening and I'm happy. Okay.
Thank you so much, Dr. Kiragu, for this informative lesson on COVID-19 vaccine and all related information to that. And yes, as you know, I'm sure that most people understood the information he provided, but we will also talk in Amharic, and I'd like to invite Dr. Tsagganesh here too. Dr. Tsagganesh Allesh.
Yeah, I'm here. Good evening.
Thank you, Dr. Tsagganesh. Dr. Kiragu, በጣም ሰፋ ባለ ሁኔታ ብዙ ነገሮችን አብራርቶልናል። አንቺስ ከሱ ጋር በመነሳት እንደው በአማርኛ ደግሞ ትንሽ ብታብራሪልን በተለይ ስለዛ መልታይ ሲስተም ኦርጋን ሲንድሮም ፌለር የሚያመጣውን ነገሮች ትንሽ እንደው በአማርኛ ብታብራሪልን እና ምን ያህል ይሄ ኮቪድ በሽታ ከመተንፈስ ያለፈና ሌሎችንም እስከ ሞት እንደሚዳርግ መሆኑንም ስለምታውቂ ከሱ ጋር እንደው አያይዘሽ ሳይድ ኢፌክቶቹንም እንደዚህ አይነት ነገሮች ቢያጋጥሙን ምንድነው የምናደርገው የሚለውን እንደው በዛ ያለሽ ብትነግሪን እና ሌሎችም በዩቲዩብ ጥያቄዎች አሉ።
ኦኬ ሶ ዋናውን አንድ ነገር ልንገራችሁ። ዶክተር ኪራጉ በጣም አዋቂ ሐኪም ነው። እኔ ሜዲካል ስኩል ሳጠናም እሱ ነበር አንድ አስተማሪ። ስለዚህ እሱ እዚህ መኖሩ እና የእሱን እውቀት ከኛ ጋር መነጋገር መቻሉ በጣም ትልቅ ነገር ነው። አይሲዩ የሚሰራበት በጣም የታመሙ ልጆች ኢንቴንሲቭ ኬር የሚያስፈልጋቸው ቦታ ደረጃ ላይ የደረሱ ልጆች ነበር እና እሱ የሚለው እና አይ ቲንክ በመጀመሪያ ላይ ኮቪድ ሲነሳ በልጆች እግዚአብሔር ይመስገን ልጆቹን በጣም አላስቸገራችን አልታመሙም እና በልጆች ላይ ብዙ ነገር አልተታየም። ግን አሁን ያየነው እሱም የነገረን ባለፈው አሁን በተለይ በኦሚክሮን እና በአዲሱ የመጣው ቬሪየንት ልጆች በጣም የታመሙ ናቸው እና ብዙ አይነት ህመም አላቸው። እዛ ስላይዱ ላይ ያብራራው የጉንፋን አይነት ስሜት ሊመጣባቸው ይችላል። ግን ይሄ ማልቲ ኦርጋን ሲስተም ፌሊየር የሚባል በጣም መጥፎ የሆነ ህመምም አለ ከኮቪድ የተነሳ። ስላይዱ ላይ ያሳየው መጀመሪያ በሲቲ ስካን ቸስት ኤክስሬይ ላይ ያሳየው ቆይ ልጠይቀው እሱን እንዲያሳየን። Hey Andrew, Dr. Kiragu, I don't know if you're able to, I'm just talking, the question is to just talk a little bit more about the multi-system organ failure. Would you show us that slide again with a CT scan so I can just explain what that was? The CT scan that you were having, that you had?
Okay, so the CT was just the COVID pneumonia.
I know.
Okay, so I'll put that up. I'll share the.
Yep, I just want to show it to them so I can talk about it. So I want የሚያሳየን CT scan ላይ ዝም ብሎ just COVID በራሱ የሚያመጣ በሳምባ ላይ የሚያመጣውን ችግር የሚያሳይ ነው። ኖርማሊ ሳምባ ስናይ ጥቁር ነው እና ጥቁር ከሆነ ደህና ነው ጤናማ ነው። ግን አሁን እዚህ ላይ የሚታየው በተለይ በኤሮ የሚያሳየው ነጭነቱ ከኮቪድ የመጣ ህመም ነው። ሶ ለንጉስ እንደ ሳምባ ውስጥ ይገባና እዛ ቦታ ላይ ነጭ የሚሆነበት ቦታ ላይ ትንፋሽ ኦክሲጅን በደንብ መግባት አይችልም። ለዛ ነው ትንፋሽ የሚያጥረን ደረታችን የሚያመን እና እሱ የባሰ ሊሄድ ይችላል። The multi-organ system failure የተነጋገረው ከሳምባ ብቻ ሳይሆን ሳምባ thank you. So ሳምባ ይተካል፣ ልብም ይነካል፣ አእምሮን አንጎልንም ይነካል እና ልጆች በጣም በዚህ ይታመማሉ እና ይሄን አይነት ህመም ወደ ለሞትም ለሚያደርስ ይችላል እና እሱን ነበር ያሳየው። እና I think ትምህርቱ ዋናው ነገር ይህንን ሁሉ አሁን ያየነው በልጆች ላይ በተለይ የባሰ ስለሄደ ክትባት ልጆቻችንን ክትባት መስጠት እና መውሰዳቸው ከዚህ ሁሉ ይከላከላል። ኮቪድ ቢይዛቸውም ህመሙን በጣም ይቀንሳል እና ከማልቲ ሲስተም ኢንፍላማቶሪ ሲንድሮም እንዳይደርሱ እዛ ደረጃ ላይ እንዳይደርሱ በጣም ይከላከላል። Andrew, I was just telling him how, first off, I told him how you were my teacher when I was in medical school and how we're very fortunate to have you here because your knowledge in the ICU sphere and in pediatrics is immense. And so just really appreciate you being here and sharing your knowledge with us. And then the question was just asking, how do kids get sick? And tell us a little bit more about the multi-system inflammatory
Thank you.
illness.
And then maybe later you'll tell them how you set me straight.
That's a story for another day.
Was there any other slide you wanted me to share, or are those?
No, I was just answering that question.
Okay.
We're just fielding questions that people had.
Yes. ጥያቄ ካላችሁ አድማጮቻችን ተከታታዮቻችን እዚህ ቻቱ ላይ ማስቀመጥ ትችላላችሁ። ዳክተር ጸጋነሽም ታያለች፣ እኔም ካላየችው እሷ ለእናንተ ለዶክተሮቻችን ለማቅረብ ሞክራለሁ። ከዩቲዩብ ላይም እየመጡ ያሉ ጥያቄዎች አሉ። አንደኛው የመጣልን ጥያቄ ይሄ በህፃናት ላይ ሎንግ ኮቪድ የሚባል ነገር አለ ወይ? በአዋቂዎች ላይ ሎንግ ኮቪድ አለ? Is there any long COVID with kids?
That's a good question for you, Dr. Kiragu.
I mean, it's not as common as in adults, but I think there are some children who suffer longer effects. It's rare, but there are children who will have effects ongoing because of the illness. And then, of course, depending on how sick you get with COVID, you can be in the ICU for weeks, and then in the hospital for some time, and then you have to go to rehab. And that's the same thing we're seeing in adults. So if your child is unlucky enough to be the one that ends up really sick, even if they're not having the long COVID symptoms, you're still having to suffer for a long time. And then, of course, if you do get this multi-inflammatory syndrome, and you happen to be one of the children who is left with issues because your heart was scarred or something else happened, then, of course, there are concerns there. And of course, I mean, there are things that can happen that, we've heard of stories of strokes in young people because of COVID, which is why when you come in the hospital and you have COVID and your oxygen is low, we put you in a blood thinner so that you don't get blood clots and you don't have a stroke. So you can imagine you're a 20-year-old, 18-year-old, and you have a stroke because of COVID. And I mean, we've had young baby. I mean, I think my youngest patient was 3 weeks old. So the 3-week-old, they can't get the vaccine. So they are dependent on their parent to protect them. And, sometimes the parents do well. Their parents are vaccinated. The other older kids are vaccinated. But then auntie and uncle say, we have to come and see this baby. Do you have your vaccine? No, we don't like vaccine, but we want to see the baby. on your baby. Why? You tell them they come to your house. No. We don't want mask. Wash your hands. If I even hear a sniff, no, baby. We have to protect our children. Yeah. And you know, I mean, you walk around, all these people walking around without even masks. Keep your kids safe.
Dr. Kiragu, your African side is showing. So የሚለው ገብቷችኋል ከገባችሁ like you know እሱ የሚያየው በሆስፒታል ውስጥ በጣም የ3 ሳምንት ልጅ ታሞ አይቷልና እና ራሳችን የኔም ክትባት ወስድ የኔም ትልቅ ልጆች ክትባት ቢወስዱ ሌላ ሰው ገዳ ሆኖ ቆይ ልጅሽ ማየት ፈልጋለሁ እናንተ ጋር መገናኘት ፈልጋለሁ ብለው ሲመጡ ራሳቸው ክትባት ካልወሰዱ ራሳቸው ከታመሙ የኛንም ልጆች ሊያሳምሙ ይችላሉ። ስለዚህ ስለሱ ነው ሁላችንም መጠንቀቅ አለብን እና ሰው ቢቀየምም መቀየም ይሻላል ልጆቻችን ከመታመማት ይልቅ።
እሺ thank you ዶክተር ኪራጉና ዶክተር ጸጋ። ሌሎችም ጥያቄዎች እዚህ ላይ የሚታየኝ አለ ምናልባት ጸጋ የሚታየሽ ከሆነ ቻቱ ላይ
አንድ አይቻለሁ።
should we wait once they have cold like symptom ይሄንን ምልክትን በተመለከተ ይመስለኛል ምን ያህል መጠበቅ አለብን ነው እንግዲህ ተማሪዎች ሊሆኑ ይችላሉ ልጆቹ ወደ ውጪ መውጣት የክትባት I'm not sure የክትባት ካል ነው ጥያቄው እርግጠኛ አይደለሁም። ክትባት ማግኘት ይችላሉ ወይ ነው መሰለኝ።
so ከታመሙ በኋላ ክትባት መቼ መውሰድ ይችላሉ ብለው ነው ጥያቄው ይመስለኛል right okay so ኮቪድ ከያዛችሁና ከታመሙ በኋላ በፊት መጀመሪያ ላይ 3 ወር መጠበቅ አለባችሁ እንል ነበር ግን አሁን እሱ ተለውጧል። so ደና ከሆኑና የነበራቸው ሲምፕተም የነበራቸው ምልክቶች ከቀነሱላቸውና ህመሙ ከቀነሱ ክትባት መውሰድ ይችላሉ። so መጠበቅ የለባቸውም እና እንዲጠብቁም አንፈልግም because አንዱ ነገር የምናየው ከክትባት የምናገኘው መከላከያ ከኢንፌክሽኑ ይሻላል። so አንዴ ከዳኑ ዋና ህመሙ ከኮቪዱ ከለቀቃቸው በኋላ ክትባት መውሰድ ይችላሉ። let me ask Andrew the question is how long after COVID do you have to wait to get immunized? I know for adults the recommendations are there's no waiting period as long as your symptoms are better you are free to immunize. Is that the same recommendations for kids?
Yeah. Before they used to say wait 3 months
90 days.
But now it's more once your symptoms are done you can. The only time now that you're having to wait longer when it's mostly for adults because this is who this monoclonal antibodies
if you got
you can go get in the infusion of these monoclonal antibodies if you have COVID within a certain period of time and you know you have COVID you don't need oxygen you can go to your doctor's office and they'll give you this but once you get that monoclonal antibody those are the ones they have to wait 90 days because then the vaccine might not be as effective. But otherwise now once you don't have symptoms usually within 10-14 days you can be able to get the vaccine and I mean there's indications that if you even then it might even make the addition of the vaccine will make you even better protected but yeah no it's important yeah. Oh, I see a question in the chat about fertility, which is of course this is one of the big concerns you know that I give my child the vaccine and maybe they won't be able to have babies. No, there's nothing to show that it impacts fertility, impacts pregnancy. There are people who got pregnant they were in the research study looking at the vaccine who either got pregnant during the time of the study were pregnant and they didn't know and nothing happened. It doesn't affect fertility. There's been concerns about could it impact your girl's menstrual cycle. Again, I mean that there's the things that impact women's menstrual cycle are multifactorial. And so but there is nothing I can say that if I take this vaccine it's going to make me not be able to have babies. Now I'm sorry to be blunt but if you're dead you're not having any babies. Get the vaccine. then for sure you'll have babies. Okay, sorry. Sorry. So, if it's too blunt, and I don't know if their children understand, but sorry.
Well said. በጣም ጥሩ ነው. Thank you so much, Dr. Andrew. That's true. Yeah, first we need to think about the worst case scenario before we think about all these other things. Dr. Tsaganesh, thank you. አንድ ጥያቄ መጣ ነበረ በዩቲዩብ ላይ. How easy was it for your family to get your kids vaccinated? እኔም ልጆች አሉኝ. የኔ ልጆች ግን ትልልቆች ናቸው. ትንሿ 18 ናት. ግን ትዝ ይለኛል በልጅነታችን የህፃናትን ክትባት ቤተሰቦቻችን ሲያስከትቡን ተምረው አልነበረም ያስከተቡንና እነሱ ካስከተቡን ልጆች በብዛት የቤተሰቦቻቸውን ፈለግ ይከተላሉ የሚል አለና እኛ ስለተከተብን ልጆቻችንም ተከተበዋል ወይስ በህፃናት ሲሆን በጣም አስቸጋሪ ነው? የኔ ልጆች ትንሽ ተለቅም ስላሉ አንበበውም ተረድተውም ራሳቸውም ሊወስኑ ይችላሉ። ህፃናቶች እስካሉ ምንድነው ማየት ያለብን? እናንተስ ምናልባት ኤክስፒሪየንስ ካላችሁ ከዚህ ላይ ትንሽ ሼር ታደርጉልን።
የኔ ልጆች ትንሽ ናቸው። ሶስት ልጆች አሉኝ ሴቶች 9 ዓመት 6 ዓመት እና 8 ዓመት የሆኑ። ለነሱ ክትባት ለማግኘት በጣም ጓግተው ነበር because እነሱ የሚያዩት ከጓደኞቻቸው ጋር ለመገናኘት፣ ትምህርት ቤት ለመሄድ፣ ሱቅ ለመሄድ፣ አንዳንድ ነገር የሚፈልጉትን ነገር ለማድረግ ሁሉ ጊዜ ማስክ መልበስ አለባቸው። እሱ ብቻ ሳይሆን መሄድ አይችሉም። ለምሳሌ ጓደኛ ቤት መሄደውና ለመጫወት ቢፈልጉ ክትባት ስላልወሰዱ በምንም አይነት መሄድ አይችሉም ነበር እና እነሱም በጣም ልጆች ናቸው፣ መጫወት ነው የሚፈልጉት እና የራሳቸውን ከጓደኛ ጋር መገናኘት ትልቅ ነገር ነው ለነሱ። ስለዚህ ክትባት ይመጣል ብለው ወሬውንም ሲሰሙ ዋና ነገር ያሉኝ ኦኬ ክትባት ከወሰድን በኋላ ከለቤት መሄድ እንችላለን፣ ክትባት ካገኘን በኋላ እዚህ መሄድ እንችላለን ብለው በጣም ጓግተው ነበር። ለነሱ እሱ ስላላ የሱ አምሮ ስላላቸው ለፍርሃቱም ለክትባት መውሰዱንም ምንም አልፈሩም ነበር፣ ጓግተው ነበር እና ሲጨርሱ በቃ ነፃነት አይነት ስሜት ተሰምቷቸው ነበር። ለማግኘት ለኛ ቀላል ነበር። ሴንት ፓውል ነው የምንኖረው እና መጀመሪያ ላይ አይቼ ነበር እዚህ ስንጀምር የፖስተር አሳያችሁ ነበር like give kids a shot የሚባል so give kids a shot የሚባል ፕሮግራም ነበር። ለኛ ቅርብ የሆነ ኮሚዩኒቲ ሴንተር ሄደን ሶስቱን ክትባት ወሰዱ። በዛ ጊዜ ጊፍት ካርድም አግኝተው ነበር። that ትልቅ ነገር ነበር። ታርጌት መሄድ መቻላቸው እና መጫወቻ መግዛት መቻላቸውም ለነሱ ብርቅ ነገር ነበር። ሶስቱም ሄደው እዛ ክትባት ወሰዱ። በ3 ሳምንት በኋላ ተመልሰን እዛ እንደገና ወስደናል። የጊቭ ኪድስ አ ሻት ሚኒሶታ ዲፓርትመንት ኦፍ ሄልት እና አሁንም ፕሮግራም አላቸው ለቤተሰቦች የጊፍት ካርድ። ይሄን በጣም ልጆች ከተከተቡ ለሁላችንም ለሁሉ ነገር ለሙላ ለከተማው ለሁላችን ለሶሳይቲ በጣም ይረዳል። ከዚህ እነሱ ክትባት ከወሰዱ ኮቪድን በዛው ይቀንሳል፣ አይተላለፍም ለሌሎች ሰዎች። ስቴዱ የመንግስትም በጣም የሚፈልገው ነገር ስለሆነ they're making it easy። እሱ ብቻ ሳይሆን ከክሊኒክም አሁን የሐኪም ቤት ሄዳችሁ ክትባት ማግኘት ትችላላችሁ ከዋና ሐኪማቸውም ጋር ማለት ነው። Did you, Andrew, your kids are older. Did you have any issues getting your kids vaccinated? We're just talking about any barriers to vaccination and how I was just telling the story about how my kids were just really excited to get vaccinated because that meant they could go hang out with their friends and have more freedoms. But your kids are older. Did they have any issues have you heard of any barriers?
No, they didn't have any barriers. And my son, I think by the time the vaccine was coming out, I have a son who at that time he was a freshman in college, so they were giving the vaccine at the college, so he got his. Our daughter, who is a senior in college, she was getting her vaccine here, and for her we were actually people do worry about could you have an allergic reaction to the vaccine, and so our daughter has a lot of allergies, so of course we were a bit worried, but she did fine, and there were no barriers. The only thing was, at least at the time they were starting to get the vaccine, it wasn't that as available as it is now. Now I mean, vaccines are so available. And you know, I want to share a personal story, and which one of the things that makes me very sad about how we've been struggling to get people to get vaccinated. In this country, it's a blessing. We have all the vaccine. It's available. It's free. And, you know, we can even get boosters. And children over the age of 12 are now able to get boosters. My father-in-law died last year. He used to be very careful. And then and you know him, he lives in Kenya. He lived in Kenya, and while we are basking with all these vaccines in Kenya, Ethiopia, so many parts of the world, not enough vaccines. But when vaccines came, he was there, he was in line, then he went, they was told, no, there is no vaccine, come next week. The next week he was sick. Some days later he died. And his two sisters also got COVID and died. So in our family, we have lost a number of people, good friends, because of this disease. And so imagine now people who want to get the vaccine, can't get it. And here we are, we can get the vaccine, it's available, and we're refusing. It's like, you know, the story of the very strong Christian who stands and there's floods coming and he's waiting. So a friend comes with a boat, tells him, hey, let me help you cross the river. It's a flood, it's coming, you're going to be taken. He says, no, I have prayed. God is going to save me. I'm covered in the blood of Jesus. I'm going to be taken. A helicopter comes. Here, let me take you. Let us save you. No, the floods come, they take him. Then he goes to heaven. He asks God, God, I was praying. Why didn't you help me? God said, my friend, I sent someone with a boat. I even sent a helicopter. And you refused. So the vaccine is God giving us a helicopter, a boat, a helping hand. We should accept it. And, you know, even if we're scared, we're nervous, remember, you know, when you lose a loved one, or and even worse, if it's your child, because of something which is preventable, the sorrow that will continue for you, that one, there's nothing you can do about it. It will be a big pain.
Thank you so much. Yeah. So, thank you so much, Dr. Kiragu, Dr. Tserha. ይህንን እየተነጋገርን እንግዲህ ያው ጸጋም ቅድም እንዳለችው የኛ የጽርሐ አርያም ቅድስት ሥላሴ ካቴድራል ይህንን በመመልከት የኒድ እንዳለ በማወቅ ለህፃናቶች ክትባትን አዘጋጅተናል። ክትባቱም በአሁኑ ፌብሩዋሪ 3 ሐሙስ ዕለት መሆኑ ነው። ከ2 ፒኤም እስከ 6 ፒኤም ድረስ ይሰጣል። ቅድም ዶክተር ጸጋም እንዳለችው ጊቭ ኪድስ አ ሻት በሚባለው ፕሮግራም ስር ነው ያለው። 5 እና እድሜያቸው ከ5 በላይ ለሆኑ ሁሉ መስጠት እንጀምራለን የዛን ቀን። ከዚህ በፊት እዛ ትምህርት ቤት ያልወሰዳችሁ ካላችሁ ወይ ክሊኒክ ሄዳችሁ ያልወሰዱ ልጆች ካሏችሁ በማምጣት ልጆቻችሁን ማስመዝገብ ይቻላል። ስልክ ቁጥር አለን 612-254-1961 ከሰኞ እስከ ዓርብ ከ8 AM እስከ 4 PM ድረስ በመደወል ቀጠሮ ማስያዝ ይቻላል። ወይም ደግሞ የዛንም ቀን ልጆቻችሁን ይዛችሁ መምጣት ይቻላል ማለት ነው። በዚህ መንግስት ባወጣውም ደግሞ ዶክተር ኪራጉ ሲነግረን እዚህ ሀገር ገንዘብም እየተሰጠ በጣም ችግር ነው። ሌላ ሀገር እንደዚህ ቤተሰቦቻችን ያንን በማጣት እየተቸገሩ እየሞቱብን ያለው። ለነገሩ እዚህ እንግዲህ የሚኒሶታ ስቴትም $200 ጊፍት ካርድ ሁለቱንም ክትባት ለሚወስዱ ልጆች ከጃንዋሪ እስከ ፌብሩዋሪ 28 ድረስ ከወሰዱ ሞልቶ ያንንም ትንሽ ጊፍት ልጆቹንም ያስደስታቸዋል ያሰጣቸዋል ማለት ነው። እንግዲህ ተጨማሪ ጥያቄዎች እንግዲህ እየተቀበለን እንሄዳለን ከዩቲዩብ። ምናልባት ለመጨረሻ ያሰብኳት ጥያቄ አለች። ምናልባት ሌላ ሞር ጥያቄ ካለ መቼ ነው ይሄ ኮቪድ ከዓለማችን ላይ የሚጠፋው የሚል ጥያቄ አለ። እሱ ወደ መጨረሻ ብናደርገው ጥሩ ነው። ምን ይመስላችኋል ዶክተር ጸጋ?
አንድ የእናንተ ፕሮግራም ነው፣ እኛ መልስ መስጠት ነው። የእናንተ ፕሮግራም ነው እንደፈለጋችሁ። እሱ ግን ከባድ ጥያቄ ነው።
ከባድ ጥያቄ ነው። ያ when do we get this COVID eradicated from the world was one of the other questions. Yeah.
የሚጠፋ አይነት አይደለም እውነቱን ለመናገር አሁን like you know እንጠብቃለን። ኦኬ ምናልባት ክትባት ሲመጣ ያልፋል ይጠፋል እያልን የጸለይን ነው። ግን I don't think ዓለም የሚጠፋ ነገር አይደለም። አሁን ዋናው እውቀት የምናደርገው እንደገና እንዳይለወጥ እንደገና ሌላ አይነት እንዳይመጣ ከዚህ የባሰ ነገር እንዳይመጣ ለዛ ነው ክትባት በጣም አስፈላጊ የሆነው። ሁሉ ሰው ከተከተበ መተላለፍ አይችልም። ሲተላለፍ ነው የሚቀየረው። መተላለፉን ከቀነስን at least you know በክትባት በሰላም you know መኖር እንችላለን። ሌላም ነገር በጣም አስገራሚ ነገር የሆነው በአንድ ዓመት ውስጥ እንዴት ብዙ እንደተማረን you know 2020 ሲመጣ ያልታወቀ ነገር ነው። ዓለም ያላየው ነገር ነው እና አሁን በብዙ መልኩ እንዴት ሰው እንደምናክም እንዴት እንደሚተላለፍ እንዴት you know prevent ማድረግ እንደምንችል አሁን ተረድተናል። እና እሱም እውቀታችን እየተስፋፋ ይሄዳል። እሱም ተስፋ አለን። ግን I don't know የሚጠፋ አይነት ነገር አይደለም። Kirago, I told him next week.
We hope.
I said I think it's something we have to live with. I think it's just going to be something that we are going to have to live with, and hopefully through immunizations and kind of preventative measures we can keep it from evolving or changing again to something that's harder to manage. But what are your thoughts?
I tell you, I don't know. And I can tell you that, and I mean, Dr. Slamab, I know you have seen this. A lot of people who work in healthcare, I mean, they are beat, you know. And then, of course, you're dealing with all the misinformation. And I don't know. I hope soon, but I wish I could tell you. If we had all started the way we should have come together cohesively and the politicians gone, maybe we would have had a chance.
I think the hard part has been ለእኛም አሁን በተለይ ለእሱ የሚለው የሕክምና ውስጥ ያለን ሐኪሞች ነርሶች ሁላችንም ደክሞናል እና በጣም ይህንን የኮቪድ ነገር like በሽተኞችን ለማየት ሁሉ ነገር ስለረበሸብን ሁላችንም ያደረግነው I don't know it's just ከባድ ነው እና ከዛም በላይ ሰው ክትባት እምቢ ሲል ወይም you know ሰው ክትባት እምቢ ሲል ብዙ ነገር ስንሰማ በፖለቲካ ላይ ያለው ክርክር ተስፋ you know I know you just lose hope.
Yeah. But these efforts that you guys are doing, this community effort, these grassroots efforts, encouraging at least our communities to get the vaccine. Let's protect ourselves. Also, the people who want to take ivermectin, let us vaccinate our children. Leave those people alone.
Thank you both for your expert advice. Before we conclude, if there's any other questions, please bring the questions right now. ጥያቄ ካላችሁ አሁን ጠይቁ። ከማጠቃለላችን በፊት ለዶክተር Kiragu, I will have one other final question. I'm sure he will be very delighted to answer that question too. Any other questions? Let me see. I think there is a YouTube question here. Is it true that COVID health impacts on individuals in lower on Africans and compared to other countries or other continents?
I'm trying to
geographically, I think they're asking.
Read the question again and again.
Is it true that COVID health impacts on individuals lower on African compared to other continents, in the lower African countries, I believe. Is there any indication that other continents, ከሌላው ዓለሞች ወደ ታችኛው አፍሪካ ሀገሮች ይመስላል ጥያቄው እንግዲህ?
I wonder if the question
Based
has
on
to do,
numbers
is
reported so far.
is it impacting, the numbers are perhaps lower in Africa than here? And to a certain
Yes.
extent, yes. It does not mean the disease is any less dangerous. And the reasons why the numbers are not as high are multifactorial, including, even something as simple as the vast majority of the population in Africa are younger, maybe have fewer of the risk factors, obesity, diabetes, high blood pressure, just because of our lifestyle, walking, like look at all the people who, especially people who struggle, who are poorer, they're walking to work, walking back home. So perhaps maybe, and thank God for that protection. But again, it's varied, right? My father-in-law lived in Kenya. So for me, the story is personal, right? It doesn't matter that the number in Kenya is lower than in the US. One of those people who died is my father-in-law. So, and then of course, the same the disease of politicians. You guys from Ethiopia know our brothers to the south, brothers and sisters to the south, Tanzania. They had a guy called Magufuli who said, no testing for COVID, we don't have COVID. Okay, really? And he died of COVID. Okay, I'm sorry to give you breaking news. Okay, and what an irony. But then no information, so you don't know the numbers. But even though the numbers might be lower, part of it also is a collection of data, which may impact. But I think we also, if we had the same number of people getting sick in Africa as we do here, just think about it. We don't have enough hospitals. We don't have enough ICUs. I mean, so.
Thank you. Yeah, that's correct. That's true. Yeah. And thank you again. There was one more question in YouTube too. ዳክተር ጸጋ ምናልባት እዚህ ውስጥም ደግሞ አስተማሪዎችም ካላችሁ ሌላም ደግሞ እንደዚህ ፔረንቶች ካላችሁ ምናልባት የምትሉት ነገር ካለ ከህፃናት ትምህርት ቤት ጋር ከትንንሾቹ ጋር ከትምህርት ቤት ከመቋረጥ አኳያ ያለን ኤክስፔሪየንስ እንዴት ነው? ልጆች ካለን እንግዲህ ትምህርት ቤት መላክ አለ፣ ትምህርት ቤት ሲቋረጥ ስራ ማለምሄድም አለ። እሱን እንዴት ነው ኤክስፔሪየንስ ያችን ያለው?
I know ለኛ የኛ ቤተሰብ ውስጥ ሴንት ፓውል ነው የምንኖረው እና መጀመሪያ ልክ እንደ ሌላ ሰው ሁሉ የኛ ትምህርት ቤት ተቋርጦ ነበር እና 3 ልጆች ቤት ውስጥ ለማስተማር እና ለመስራት ሞክረን ነበር መጀመሪያ ላይ። I'm telling you እሱ ከህክምና ከማድረግ ይልቅ እሱ ነው በጣም የከበደን ለኛም ለልጆቻችንም። እንዳልኩት የኛ ልጆች በጣም ትንሽ ናቸው። 3ኛ ክፍል 1ኛ ክፍል ፕሪኬ ነበረች በዛ ጊዜ እና ለነሱ እንደዚህ ለመማር አልቻሉም። አይተነዋል። አሁን ለምሳሌ በትንሽኛዋ እሷ ያላት ዕውቀት እና የእሷ እህቶች ያላቸው ዕውቀት አንድ አይደለም። ለአንድ ዓመት በቃ እንዳልተማረች ነው የሚቆጠርላት። ከባድ ነው ቢካዝ እዛም የሄዱ ሊታመሙ ይችላሉ። እዛም ያሉ ከሌሎች ልጆች ጋር ኮቪድ ላላቸው ልጆች ጋር ሊገናኙ ይችላሉ። አስተማሪዎችም አሉ። ከባድ ነው። ለእኛም ለመወሰን ምን እናደርጋለን ብለን ለመወሰን ረጅም ጊዜ ፈጀብን። ዕውቀት አሰብንበት። እኔም የኔም ስራ አለ፣ የባለቤቴም ስራ አለ። ልጆቹም እንዴት እንደሚሆኑ ቤት ውስጥ የነሱ ጠባይ እና የተማሩት ነገር አንድ አልነበረም። እኛ የወሰንነው ይህን ሁሉ አይተን ትምህርት ቤት ለመላክ ነው የወሰንነው። ግን አንዳንድ ነገር አድርገናል። ለምሳሌ በአውቶቢስ አላክናቸውም። ከዚህ የኛ አውቶቢስ ላይ ሲቆዩ 30-40 ደቂቃ መቀመጥ አለባቸው እና አንድ ሰው ልጆቹን በሙሉ እያየ ማስክ ልበሱ አልልበሱ የሚል አዋቂ የለም፣ አይችልም አንድ ድራይቨር። እሱን አትሊስት ኦኬ መሄድ አለባቸው ብለን ወሰንን። ሁሉ ጊዜ ማስክ መልበስ ይችላሉ እነሱ they're okay So ማስክ ለበሱ እና ክትባት ከመጣ ወዲህ ግን በጣም ትልቅ የአእምሮ እረፍት ሰጥቶናል። ቢካዝ ክትባት ቢወስዱ እና ኮቪድ ቢያገኙ ሰው ጋር ቢገናኙ የእነሱ እድል የመታመም እድላቸው ትንሽ ነው እና ቢታመሙም ወደ ሆስፒታል ወይም ወደ ሞት ደረጃ የሚደርስ አይነት ህመም አይሆንባቸውም። ለእኛ በሱ ነው የወሰንነው። ቢካዝ ለእነሱ አሁን እህቴ ግን ለምሳሌ እሷ ልጆች ትልቅ ናቸው፣ ሃይስኩል ውስጥ ናቸው እና ሃይስኩል ላለው ልጅ ቤት መሆኑና ቤት መማሩ በጣም ስለተመቸው በዛ ወስና ነበር መጀመሪያ ላይ ነው ቤት ለማስቀመጥ። አይ ቲንክ ሁላችንም ለልጆቻችን አይተን ለነሱ የሚሆነውን ነገር መወሰን አለብን። ከባድ ነው። ክትባት ከወሰዱ ግን አብዛኛው ልጆች ክትባት ከወሰዱ አስተማሪዎቹ ክትባት ከወሰዱ ምንም ችግር የለውም፣ ይሄዱ ምን ይሆናሉ?
So I just wanted to add one other reason why the numbers in Africa might be lower is testing is not very common. Here you can get tested for free.
Yep.
And I don't know what it's like in Ethiopia, but I know in Kenya you have to pay for your test. And it's anywhere from $25 to even $80 to get a test. Now, who is paying that money? So that's another reason. So the numbers could be potentially higher, but people can't pay there.
Andrew, the other question that they were asking, maybe you can talk about this as a pediatrician, is the impact that they've seen on kids who have schooling. So how school was interrupted and doing like just the risk benefit analysis between in-person schooling versus. And so I was just sharing the story that for my elementary school kids, at home schooling didn't work for them. They've essentially lost a year of education despite everything that we were trying to do at home. So we made the decision to send them in. But have you heard of what has been the pediatric recommendation, or what is the consensus?
The American Academy of Pediatrics strongly recommends that schools stay open because kids do better in school. It's more structured, there's more social interaction, they can get help from their teachers. And then of course, there are many kids who get out of special services in the school. There are some children for whom that's where they get meals because of the poverty in which they live. One of the things that we saw with the pandemic, and then of course people being told not to go to school, is a significant increase in mental health problems, especially in the older teenagers. They were removed from their social groups. So you're seeing more children struggling with mental health problems, increased suicide attempts, and then of course increased behaviors that are not acceptable. And then for other kids, okay, if you live in a diner or Minnetonka or whatever, and your family is well off and you have 2 computers, 3 computers, whatever, your kids can go to online school. Yeah, but there are some families, they don't have computers, or maybe mom is working on the computer because that's work, she has to work, so you can't use a computer to go to school. There were these students who are having to do papers. Can you imagine writing your term paper on your phone? There are families with no internet. So even though for some kids it was disrupted, for others it was even more disrupted. And I don't know what happened in Ethiopia, but in Kenya, because when kids were told no school, because the government recognized that kids who live in poverty were going to be impacted more, it was going to be disparate, all the kids had to repeat the year. Of course, it's very harsh, but then it at least tries to level the playing field a little bit. But of course, then the kids, now you can imagine, even for the kids, now you have had to repeat a year, you had other plans. I mean, it's very difficult. But that's the importance of getting vaccine, so you can limit this disruption of schooling. so that kids can be able to go to school and whatever. But now look at what's happening. Look at your school boards. Who is trying to get in the school board? The person who is going to say, I don't want my kid to wear a mask, or I want to be in charge of when my kid has COVID, when they can go back to school and infect the other kids in school. This political nonsense. Yeah, so, but anyway, I sometimes veer on politics, so forgive me. But it's, I mean, vaccines, all these things will help to protect children and then limit disruption of education for our kids. This is going to be the way forward. I mean, if we want our kids to go back to school, then we have to vaccinate them. And I saw even Glenn Shokena wrote that for their family, their kids, once they knew that they won't be disrupted as much,
it
helps. But all the kids have to be, if they can.
They have to be. So ዋና ነገር ያለው ማብራት የፈለኩት ይሄ የአሜሪካን አሶሲዬሽን ኦፍ ፒዲያትሪክስ የልጆች ሐኪሞች እነሱ ልጆች ትምህርት ቤት ውስጥ እንዲቆዩ እንዳይዘጋባቸው ነው የሚመክሩት እና ለዛ ነው ክትባት አስፈላጊ የሆነው ሰው
ያ ትክክል ነው ዶክተር ኪራጉም ብሌን ያለችውን አንስተዋል ትክክል ነው ቀደም ዶክተር ጸጋም እንዳልሽው ልጆች እንደው ኢንሴንቲቭም ይሆናቸዋል ብዙም አንደርስታንድ ባያረጉትም ትምህርት ቤት አትሄዱም ልጆች ቪዚቲንግ አትሄዱም ሲባሉ ክትባቱ ለነሱ እንደ ማበረታቻም ሊሆንላቸው ይችላል ነው ለብዙዎችም አይ ቲንክ ፋሚሊዎች ይሄ የሚሰራ ይመስለኛል ልጆችንም ለማሳወቅ እና ደግሞ በተጨማሪ ደግሞ የአእምሮ ጤናቸውን ለማጎልበት ግዴታ ቤት ውስጥ ለረጅም ጊዜ መቀመጥ እንደሌለባቸው ጥናቶችም እንደሚያሳዩን እኛም ደግሞ እንደ ወላጆች ይሄንን እየተገነዘቡ ነው ያለነው ነገር ነው ሌላ ጥያቄዎች እንግዲህ ከሌለ ወደ ማጠቃለያው እየደረሰን ነው ዶክተር ጸጋ መጨረሻ የምትይው ነገር ካለ if there is anything else Dr. Kiragu we're getting closer to the end here anything you'd like to add before I ask you that final question not COVID related
No, I think I want to hear COVID ለሁላችንም ለሐኪሞችም ለወላጆችም ለቤተሰብ ሃይለኝ ትልቅ ትምህርት ሆኖብናል እና ሁሉ ነገር እንደ አዲስ ነገር ማየት ኖሮብናል ግን ክትባት የኮቪድ ክትባት እንደሱ መሆን የለበትም ልክ ሌላም ክትባት እንደምንሰጣቸው ጓግተን የፖሊዮ ክትባት የቲቢ ክትባት የቲቢ አይደለም ግን የቴታነስ ክትባት እንደ ጓግተን ለልጆቻችን ለነሱ ጤና ብለን እንደምንሰጣቸው የኮቪድንም ክትባት እንደዛ ማየት አለብን ይሄ የተለየ ነገር አይደለም ልክ እንደ ሌሎች ክትባት ነው ለልጆቻችን አስፈላጊ ነው ለሁላችንም አስፈላጊ ነው እና በደንብ ይሄንን እንደዚህ አይነት ፕሮግራም ላይ አይተን ጥያቄያችንን ጠይቀን መልስ ካገኘን በኋላ እንደምንም ብለን ከእግዚአብሔር ጋር ለልጆቻችን ክትባት ማስከተብ አለብን እነሱ ካልተከተቡ እኛም ካልተከተብን ይሄ ነገር የሚያልቅ ነገር አይሆንም
Thank you so much Dr. ጸጋ አሁንም እንግዲህ ክትባቱ እንግዲህ ምናልባት ጊዜ እንኳን ባይኖራችሁ እዛው በመታወቁበት ቦታ ቅድስት ሥላሴ ቤተክርስቲያን 2601 ሚኒያ አቬኒው ላይ ፌብሩዋሪ 3 ከ2 p.m. እስከ 6 p.m. ከ5 እስከ 11 ላሉ ሆነ ተብሎ የተዘጋጀ ፕሮግራም አለ M Health Fairview Ministry Department of Health እና የጤና ክፍላችን ያዘጋጀው እሱን ከፈለጋችሁ ልጆቻችሁን ማስከተብ 612-254-1961 በመደወል ኢንፎርሜሽኑን ለማስመዝገብ ትችላላችሁ ማለት ነው going back to Dr. Kiragu. Dr. Kiragu, final question for you. Who is the best long-distance runner in the world?
Is it my brother Kipchoge from the slopes? Yeah.
We'll make it a tie for today. I just brought it because there is a big rivalry between Kenya and Ethiopia.
Yes. No, I really appreciate this opportunity. and the efforts that you're making. Of course, I'm so proud to be on with my colleague, Dr. Salama, and it's always good to see her. And you know, thanks for all the questions and for the interest. And it is my prayer that we can get through this pandemic.
Thank you so much. Thank you all. እግዚአብሔር ይስጥልን አብራችሁን ስለቆያችሁ በእንግዶቼ ስም በጀርባ ሆነውም ደግሞ በሚያስተናግዱን በዩቲዩብ በዚህም ቻቱን እየተመለከቱ ላሉ ወንድሞችና እህቶች ስም እያመሰገንን ፕሮግራማችንን በዚሁ እንግዲህ እናጠቃልላለን። እርስ በርሳችን እንግዲህ እንጠባበቅ፣ እጃችሁን ታጠቡ፣ ማስካችሁን ማድረግ እንዳትረሱ። ክትባት ደግሞ ኦፈር ሲደረግላችሁ ክትባቱን ተከተቡ። ማጎልበቻም ደግሞ ሲመጣ ደግሞ ማጎልበቻው የደረሰላችሁ ማጎልበቻውንም መከተብ አለብንና እርስ በራሳችን ተጠባብቀን እንግዲህ ያ ተስፋ እያደረግን ያለነውን ወደፊት አንድ ቀን የዛሬም ዓመት 2 ዓመትም ይሄንን ቫይረስ ከዚህ ከምድረገጽ ለማጥፋት እንግዲህ አብረን እንስራ እንላለን። በእግዚአብሔር ስም ሁላችንን እናመሰግናለን። Thank you so much. እግዚአብሔር ይስጥልን። Thanks Dr. Kiragu.
Thank you, አብሮ ይስጠን. Thank you.
Kwaheri.
Oh,
Kwaheri.
asante sana.